Minister Sachs, thank you for being here. Corporal Lionel Desmond reported post-traumatic stress disorder symptoms, including suicidality, paranoia, and homicidal nightmares. And yet 2 mental health professionals still approved his application for a firearm license. Dr. Jaffe, an expert witness for the inquiry regarding the deaths of Aaliyah Desmond, Shayna Desmond, Brenda Desmond, and Lionel Desmond, posthumously identified 20 out of 41 risk factors for domestic homicide in Corporal Desmond. The report has 3 strong recommendations regarding mental health and firearms. Minister, will the government commit to recommendation 23 that the Office of the Chief Firearms Officer should receive additional funding to facilitate additional and ongoing...
Madame la Ministre.
Thank you for the question. What I will say is this, with regards to those commitments, both Minister LeBlanc and Minister Blair would be more well-suited to in terms of the adoption and earmarking of the allocations. However, what I will say is that in my time in Parliament and even before coming to Parliament, I've seen dramatic shifts in how both our military and national policing address stress disorder. They recognize now that they need mechanisms in place to be able to support those in service to our country, to protect our communities. They see trauma each and every day, and there needs to be early warning and prevention systems. I recently joined Minister LeBlanc at the National Policing Breakfast, where they shared their data of the early implementation of early prevention and surveys that they are doing to help those in service. And I know that as a government, we are fully committed to make those who serve Canadians are both resilient and well in their work each and every day.
Senator Bernard.
Will the government commit to recommendation 22 that the Chief Firearms Office should, in appropriate cases, place certain licenses under review and seek additional medical information, if necessary, to ensure that applicants who have been granted licenses are continuing to meet eligibility requirements and maintaining good mental health?
Madame la Ministre.
Again, I am not the minister of that file to be able to commit to those recommendations, but as the Minister of Mental Health and a member of Cabinet, I will certainly encourage my colleagues to prioritize what are the key prevention tools that must be considered in all of our enforcement and service providers to Canadians. Mental health preventative measures should be available in every workspace, in every workplace, which is why we have a national standards system being drafted right now for exactly that purpose.